Professor Jeffrey Crowley, one of the nation's leading voices in public health policy. As President Obama's HIV/AIDS policy director, he played a key role in shaping the nation's first comprehensive HIV/AIDS strategy. Now at Georgetown University, he continues to teach and write and lead on issues of health and equity and science-based policy. As we talk about the crossroads we face in public health leadership, especially in this moment, I want to first start off by saying, like, how we met. I remember being an intern at the White House in 2010, and I don't know if I emailed you but what I was doing as an intern was like, I'm a hustler, right? So I'm like on the White House Scout, the global address list, and like looking up interesting people. And I don't know if I had done this with you. Like, I emailed you, was like, oh my gosh, your work is so fascinating. Maybe we can grab coffee. But I did it to a lot of people. So I don't know if I did that to you. Do
Right.
you remember how we met?
I don't remember how we met specifically, but I remember you and there's a cohort of you, like John Monger and a couple others. We're so different than the previous classes, and we're still friends, right?
Yeah,
So
yeah.
yeah, so I just remember that you were all a lot of fun, and you were not shy. Like, we didn't think of you as like temporary interns. We just thought you were part of our work experience. So, anyway.
Well,
But
that's
you
an
and I
honor.
also obviously have become friends, and it wasn't just like you left and then it was there. Like, we stayed friends. So anyway.
Yeah, it's already been over 15 years, and I've always seen you as a mentor and as somebody who is driven also by science, especially now the society that we live in. So important to have voices like yours speak truth to power.
Uh-huh.
And we'll go into our first question. What are the implications of RFK Jr.'s firing of CDC Director Susan Menarez and dismissal of all 17 members on the advisory panel on immunization practice? And most of those people have been replaced by these anti-vaxxers and people who are lacking vaccine experience.
So at the risk of like taking a small question and making it huge, like, I don't think you can look at this firing in isolation. We need to step back and say, and I can't even talk about everything that's happening with the Trump administration, but just in public health.
Sure.
First, we need to start off with this frame. Like, we're a very individualistic country, and even in health, we think about what do? We have insurance that protects us as individuals. Public health or population health is very different because think about how do we make all of us healthy? Right. So then when we get to things like vaccination, yes, people should have control, bodily autonomy, but there's sometimes when there's a balance between your individual preferences or individual rights and the public good, they come in conflict. These are not new fights. Like, the seminal Supreme Court case was from like the early 20th century around mandatory smallpox vaccination. So, you know, many of Secretary Kennedy's views were shaped by the COVID response, and maybe there are cases where it's like overhanded from government, but that's in the realm of like the things we can debate, and we can say, oh yeah, maybe the vaccination mandates were too stringent. Maybe we should have done it for healthcare workers, but not for others. But what's happened instead is this idea that we just can't trust any of the people in government, and it just feels like that we're in this
Yeah.
mode where we're trying to burn everything down. And so it's not to say that he has a view about vaccination and the experts at CDC have a different one. It's more about we need to make it so nobody trusts anything that the CDC says in any area, right? And so I don't know how we deal with it, because I think when I think of this problem, some of it we talk about disinformation. That's an element of it. We talk about trust. That's another element. I think we also need to think about, like, we have a federal workforce that has been beaten up, but certainly starting with COVID, traumatized by things that happened. People that, are public health heroes and being yelled at in their communities. At the CDC specifically, I've spoken to more than one colleague where they tell me, like, I have bullet holes in my window from that recent shooter. So there's a trauma there.
Wow.
And there's the issue around money and funding for public health, and then just our capacity. And our capacity doesn't exist just at the federal level, it's at the
Yeah.
state and local level. But a lot of it is federal funding. And so it feels like we're trying to blow up all of this. And how are the American people going to be healthier? Or how are we going to be better off? So getting to Susan Monarez and her dismissal, it seems like, she was just recently confirmed and they thought she was someone that's just going to go along with them. And maybe she was willing. And people that are civil servants in the federal government, their default should be that they work for a president that was elected by the American people. So the default is you take the direction when it's appropriate. But at
Yeah.
the same time, her job as the head of CDC was to follow scientific evidence in the
Yes.
interest of the American people,
Right.
There was a line she didn't want to cross. I've never met her. I don't know her, but Dr. Dimitri Daskalakis was one of the people that resigned. He was director of the vaccine center,
Okay.
and he has taken a lot of hits. He was very public in his resignation. I know how smart and thoughtful he is, and I don't think he does anything lightly. But now, I mean, he's a very out queer person. You know, he's very sex positive. He was attacked before he got to the Biden administration. In the Biden administration, when there was the Mpox outbreak, he had
Yeah.
been the head of the HIV center at CDC. He
Okay.
was detailed to the White House and was deputy director of the Mpox response. And
Yeah.
so a lot of people went after him then, but like that's why he has trust. Like that was an outbreak that impacted gay and bisexual men. He
Yeah.
had the trust of that community that let him be effective. He went to the vaccine center and built the trust there, and now he's being tacked as though he knows nothing, he doesn't care. So it's just really hard to like make sense of all of this, other than just they want to destroy it all.
So why? So I remember some clips from the Senate Finance Committee hearing, and he did say to a senator, CDC is, if not the most corrupt, one of the most corrupt agencies in the federal government. Why does, where is that coming from?
So I don't know that I can answer that with him, but I would say a couple things. One, it's much easier to scare people than to reassure them. I could give you facts about how many lives COVID vaccination saved, but you just hear from a friend about one person that had it, and it always gives you this hesitancy. When he faced these questions in that Senate finance hearing, I don't think he had a strong rebuttal. So he just says things like, "You're lying, you're corrupt." He's not giving any, because that works for some people. I believe I've read that his approval rating is underwater. So more people disapprove than approve, but he's at the same time the most popular member of the Trump cabinet. So people that say, "Oh, if he says it, I'm going to trust it." It's like some of these things play out over decades. What did Ronald Reagan say? Like, no more scary words, and I'm from the federal government. I'm here to help you or something.
Mm.
People have heard these messages over, and so they're inclined to believe that if he says the CDC is corrupt, they're corrupt. Instead of thinking, like these are the landmark successes they've had, over decades. And also the people that do these jobs, they're not in these jobs because they're getting rich. They're doing it because they're serving the American people.
So 1,000 current and former HHS employees,
Right.
alongside leading medical organizations, have called for Robert Kennedy's resignation. And kind of along the lines of what we were saying, how do these mass firings and this institutional upheaval affect public trust in the CDC and federal health agencies?
I think, it's interesting when you look at who's been appointed over these cabinet officials or a lot of the political appointees,
Right.
with almost without exception, they're not people that were like the leaders of their field. The education secretary wasn't working in education, wasn't known. And so you get the impression that they think expertise just doesn't matter, background does. Whereas like where I sit, I take great faith in the fact that like our leading of whether it's the CDC, the NIH, these are people that have spent their careers
Right.
working in this field. They act as though it doesn't matter, and we've lost a lot of that expertise. But
Mhm.
also, it's like we're destroying the agency both from the top, from leadership that's moving us in a direction that isn't appropriate, that's focusing on the wrong things. But then the implementers are all either being fired or leaving because they're not being valued. And then when something happens, they'll use it as fresh evidence why government doesn't work.
I texted you this week. I think it was a press release from our governor of Washington, Bob Ferguson, talking about the formation of a health alliance with California, with Oregon, and now with Hawaii. The CDC has always been a trusted, science backed agency where we have gotten recommendations on vaccines and immunizations and what's important for the public good. And I've never seen that as a political thing. It shouldn't be politicized. And I feel like people's trust in the CDC has been shaken a bit. I am scared that the future credibility of CDC is on the line. What's your take on the formation of this health alliance?
So, David, you're going to think with every question you ask, I'm going to talk out of both sides of my mouth. So, the first thing I would say is, I am a returned Peace Corps volunteer. I've had these experiences in my life where I've thought about what it means to be an American. And I think many of us that tend to be more progressive think like patriotism is sort of like a bad thing. I believe in America. Our country's motto is E pluribus unum. out of many one. I think we need to hold on to that and get back to that. But I think at this point in time, we also need to survive. And when I hear about these alliances among states, that's a key part of surviving. You
Mm,
hear these terms about like soft session, and I don't want to think about like we're in a civil war and we're seceding. I
yeah,
think these are things that are how we survive. Also, we have a system of federalism. Our system isn't, and certainly in public health, the Constitution gives primary responsibility for public health to states. We, in some ways, have let states drop the ball because most of the money for public health now comes from the federal government.
yeah.
Maybe there needs to be a bit rebalancing where states generate more of the revenues. But at
Mm,
the same time, they are supposed to be in the lead. But I also think at this time where they have a federal government that as much as not is often antagonistic and not a full-fledged partner,
yeah.
they should be working together. And this alliance that you mentioned of Western states, I'm hearing that this is happening with Northeastern states. It came from a meeting where people were talking about the South. They would never do that, but why not? Why shouldn't? Because it's not, and you don't even need to think of this as like countering the federal government. It's just like, how could an Alabama, Mississippi, Kentucky, how could they band together and do things? You know, if they're have to be more reliant on their own data systems, how can they learn from each other? So I think that is only possible. The other thing I would say is part of what this is if we can't trust the expertise of the CDC, we need to look for other places for expertise. Some of that can come from these state collaborations, but there's also professional societies and other groups that can provide that expertise. So if we can't trust ACIP about childhood vaccinations, we can look at the American Council on Obstetricians and Gynecologists. What do they say? You know, there's other places. And many of these organizations already do evidence-based reviews. Even if the CDC does it as well, they look at the studies that are out there and can give credible recommendations. So I think part of our job in this period is to highlight other sources of expertise. But what you'll find is even where there's differences, it's like there might be a difference around the edges. They're not going to be fundamentally different because if they're all following the science, as a whole, it's going to push them all in the same direction. They
Mm.
might have slightly different perspectives about, some issues, but I think that's part of the solution.
And I think I want to be clear here. When I say the politicization of CDC, I'm talking specifically about the head of the agency, which is Robert Kennedy. I had,
Could I take us back a second? So you mentioned ACIP, and I want to explain. ACIP stands for the Advisory Committee on Immunization Practices.
okay.
These are external experts. It's one of a couple of bodies that have, like under the Affordable Care Act, the ability, like when they recommend something, it causes these preventive services to be provided free of charge. I'm much more familiar with the sort of like sister process, the USPSTF, or the United States Preventive Services Task Force. And for HIV PrEP, they give recommendations, but I'm not always clear which one it is, but the fact that we get free colonoscopies, free flu shots, it's because of these high evidence-based ratings. I also like want people to understand like just the high level of expertise. It's not just that these committees have smart people. They have smart people that have specific expertise in how to evaluate evidence. So I often
Mm,
talk about like CDC puts out guidance that is not USPSTF guidance. So CDC, like if there's a scientific question, so if you're governing, whether you're the president, the governor, you're a public health official, you have to make decisions with the information you have. Sometimes we don't have all the information we need. So CDC, and again in my HIV space, will put out guidance, for example, on how to implement pre-exposure prophylaxis, who should get it, when, all that. The USPSTF evaluates PrEP, but if it's a new intervention and they evaluate too soon, they might come back with a bad rating because the evidence isn't there. Then
yeah.
when they have the evidence, they can give it a high or low rating. And so we have experience where they have disappointed us, where we wanted to get a high rating to make something free of charge, and they said no. And this isn't about politics, it's because they have a rigorous standard about what the evidence tells us. When the evidence isn't there, we have these other bodies like CDC guidance, HRSA guidance, and other things to
Yeah.
fill in the gap. It's like best judgment. That's also where we look at professional societies. But if you have these different gradations of evidence review, these groups, ACIP, are at the top. The U.S. Preventive. So the idea that they could just be summarily fired and then find different people that would have fundamentally different views of what the evidence says tells you they're not following the evidence.
Thank you for that's a very important clarification. And I think to your point, we got to follow the evidence. The evidence is all going to point towards the same thing, right? And so even if you politicize it at the top, there's going to be bodies that predict what they're saying, and there's going to be more bodies that are going to say the same things. So on the issue of Florida, I have nieces, I have family members likely be the first in the nation to remove vaccine mandates in schools. What is the signal to America, and how do we protect our children?
Well, I think we need to think about what this is. So I work in HIV. Globally, the United States, the American people until recently have done amazing things. I'm so proud of what we've done. Like we were providing HIV treatment to more than 20 million people, but it wasn't purely altruistic. Our interests are served when we curb the pandemic in Africa and other places. It reduces the risk to the American people, right?
Right?
That's far away. When Texas has the biggest outbreak in years, do we think those of measles outbreaks, do we think those measles cases are going to stay in Texas or are
Right.
they going to spread to Oklahoma?
It'd be spreading.
So, we talk about like getting rid of mandates is all giving people freedom is always the best answer. But if we think about a spectrum, your individual right and our collective rights, it's really pushing us away from where if you're going to just hold up this individual right, you're increasing the harm to the population. So this policy, if it's implemented, like he says, it will lead to more death and disability, childhood illnesses. And we've seen an interesting thing. So Mitch McConnell, senator from Kentucky, isn't someone I hold up as someone that's shown a lot of leadership. He had polio as a child, and he's been very critical of this because sometimes people talk about how vaccines have been so effective. People living today don't have a real world experience of what it was like when we didn't have these, and they were produced a lot of harm. And so, one, I would just say that what do we do to protect ourselves? I don't think there's an easy solution, but I do think we should all get our vaccinations for ourselves and our children when they're recommended. Whether you have to, if Florida, they're not saying you can't get it as far as I know. They're just saying they're not going to require you. But if you're in Florida, you can't protect yourself from what other people around you are not doing. Right now, there are concerns about like our ability to get COVID shots. And here in Washington, D.C., and I think 16 other states, CVS and some of the other pharmacies aren't giving the updated COVID shot yet because of some of these actions and the uncertainty it's created. And so that's deeply problematic, right? So it's one thing to say, we could have a debate about when it's appropriate to force someone to be vaccinated. But now we're in the realm of where we're not letting people get vaccinated when they try, or we're creating financial barriers for like people that, need to have their kids vaccinated. There isn't a payment source because of insurance doesn't cover it because of some of the policy changes they make.
I'm just
Sorry.
flabbergasted that this is happening. I think, we had a president who had polio, right? FDR had polio,
Right.
served 4 terms, led us through World War II. If he were alive, he would have been a staunch advocate of having vaccines.
If I could also look to the future, I don't know, you focus a bit on CDC, but we can also look at how they're destroying the NIH. And the
Mhm.
secretary's recently cut $500 million of investment in mRNA research.
Yeah.
The only reason we had a timely, effective COVID vaccine is we made investments over decades in HIV research that led to the development of the mRNA platform. There's a lot of hope for mRNA, for HIV, cancer, lots of other areas. He cut that. But I'm also worried not only about like new strains of COVID, more virulent flu, but also bird flu. We could have another pandemic that crosses into humans and we're undercutting the tools that could help us prepare. And the other thing I would like to say is as we're having a conversation about how negative everything is, but I also think we need to step back and just like have a moment of pride. Like you mentioned, like with FDR, we had a president that's with polio and how bad it was. Think about how like great our lives are that we have fewer worries about infectious disease.
Yeah.
We can look at the CDC, the NIH, HRSA, all these agencies. The American people don't have to spend a lot of time worrying about these agencies because they're doing their job day in and day out and they're making our lives better. And
Mhm.
so I think there's a danger if we're trying to motivate people to take these issues seriously, we also have to celebrate what's gone right instead of just highlighting what's gone wrong.
I
So
think to your point of mRNA, Operation Warp Speed that started under Trump, we were able to produce the vaccine for COVID in a record breaking time that saved arguably millions of lives, right? And so the celebration is people are alive because we developed this vaccine. And I was reading Ezra Klein's Abundance, and he talks specifically about this case about Operation Warp Speed and how government can be efficient. And Republican or Democrat, we're here to protect Americans. We're here to promote public safety and make sure that people have what they need to protect themselves and other people. And I think the mRNA vaccine is a great example of that. So thank you for highlighting the things that we have to celebrate and what the CDC and the NIH has done for Americans and for the world. But you led the nation's first HIV/AIDS strategy under President Obama. And in June, Democrats in Congress sent a letter to Kennedy concerning Trump's widespread elimination of HIV and AIDS related research, vaccines, and life-saving programs. Given your background as leading the first comprehensive HIV/AIDS strategy, what does this mean for the future of HIV/AIDS research?
So when we look at the history of the HIV epidemic, I think, we know that like Reagan was slow to respond, but overall, I think the American people can be proud of what we've done. We've sustained a strong response domestically and globally over a long period of time. When President Obama was elected, he had made this commitment saying we needed a national strategy to, coordinate our efforts.
Yeah.
A few things came together then. Pre-exposure prophylaxis, for the first time, was shown to be effective. The FDA approved it early in his first term. Now we've rolled that out. We don't have enough people on it, but we're up to like 600,000 people. It's a tool that's highly effective at preventing HIV. There's a lot of debate before about when people who are diagnosed with HIV should start treatment. Should they start right away? Should they wait or like sort of conserve their HIV medicine until later in their illness? Expensive randomized control trial funded by the National Institutes of Health. We definitively answered that question that you want to start treatment as soon as possible. And we've seen increases in viral suppression in people with HIV. In our Ryan White HIV/AIDS program, about 90% of people with HIV are virally suppressed. That means they both cannot transmit the virus and they're staying healthier. So all of this is like we're seeing better health among people with HIV, falling rates of new cases. Just a couple months ago, the FDA approved a prevention shot that only needs to be delivered twice a year.
Yeah.
It's potentially transformative. This is a time where Congress and the president's administration be saying, we're going to devote a lot of resources to make sure everybody that wants this can get this shot. And this is how we end the HIV epidemic, not only in the United States, but around the world. At the same time, now we wonder, where's the money going to come from to deliver this? Are we going to have the public health infrastructure to take advantage of this? And yes, and at full disclosure, I'm funded by a number of companies that develop products for this. I don't market any products.
Yeah.
But the backbone, a lot of this stuff is based on NIH and other federally funded research that got us to this point. So we made these investments and now we're going to like skip the payoff and save lives.
What's your favorite memory of serving as the first director at the White House for HIV/AIDS strategy?
If you wind me up, I could tell you like so many stories. I don't know one that jumps out, but one time I had an experience that I think told me something about who President Barack Obama is. In addition to being the HIV/AIDS advisor, I was a senior advisor on disability policy. And for an anniversary of the Olmstead v. LC decision, it's a landmark Supreme Court case that interpreted the Americans with Disabilities Act. LC stood for Lois Curtis, and there are two plaintiffs, Lois Curtis and Elaine Wilson. These were two women with profound intellectual disabilities. One of them came in to meet with the president, and she had painted a self-portrait. Now, let me tell you, I said she has profound intellectual disabilities. So she came in and was meeting with him. She had her entourage, and she says, I wrote you a letter. You're going to write me back? But as a manifestation of her disability, she asked that question like 40 times. And to see how he engaged with her, he's like, I'm working on it. It's in the mail. And I just thought like he really could relate to her. The whole group, I mean, what happened is like these people met with the president of the United States in the Oval Office. They're all energized. So I closed the door to the Oval and they basically like ran out. But it was me, Kareem Dale, our colleague who also worked on disability policy as a photographer, and a White House intern who had a disability. And he turned to her. He's like, are you a member of my staff? Can I get a picture with you? Every second of a president's time is valuable. The fact that he took that time told me something about who he was.
Oh my
And then, of course, we like left. This all unfolded very quickly. We left. Kareem and I went out to like say goodbye to our guests, and the Secret Service agent, the receptionist in the West reception lobby were laughing because they like were so energized. They basically ran out of the building, and so we found them on the driveway. But it's things like that where it's like one like the personal experience that we got to witness these things.
Right.
But like I thought those interactions, both with this intern but also with this woman, told us a lot about who our president was at that time.
What a great memory. I think one of my favorite memories also, and we were still in DC at the same time, is when gay marriage passed. And I did not think that that could happen in my lifetime, but have also seen how quickly LGBTQ rights were advancing under the Obama administration. And now we're living in a time where that may be taken away. The pendulum swings, right? But it was a momentous time. I don't know if we were all together, but we did celebrate. It was just this collective joy that was so deep, right, within people who had never had that kind of freedom
Mhm.
and the ability to dream of equalities. I share those memories with you, and I want to go back
Could
to
I?
those days. And who excites you in the Democratic Party right now when it comes to potential presidential contender in 2028? Who and
I
why?
re I really don't have a presidential contender right now. I mean,
Okay.
so Zohran Mamdani, I don't know, like I'm not a New Yorker, I don't know everything about his politics. I'm excited about how he engages. You know, the fact that he's in the streets talking to everybody.
Yes.
Do I think a public grocery store is the solution? I'm not sure. And I'm
Yeah.
also not a New York, so it's almost like I don't have an opinion on that. But what he is doing, I think is really special. I believe the split between in the Democratic Party right now isn't between moderates and progressives. I think it's between like the fight or no fight. I definitely
Mm.
believe we need to engage, and we have to have the faith that we believe in some things, that we're not just trying to like get the worst possible answer, or that we're afraid that no, we have to believe that we're fighting for everybody believes in. A lot of things that we're seeing happening with Secretary Kennedy and others are not popular with the American people. So
Right?
we have to show we're willing to fight for the things that we believe.
Ugh, Jeff, this was gold. Thank you so much for your time.
Thank you.
I think the American people need to hear this because we need to hear from experts, first of all, people who aren't necessarily political, but are backed by science. You have served in so many capacities, continue to serve as a professor, doing very critical work at Georgetown. And I'm just grateful that you take the time to have this conversation.